Hello, I'm Dr. Charles Meakin. I'm a 30-year oncologist. Since May of this year, I work for Care Oncology Clinic. And I'm happy to be working for them because I believe in metabolic principles. And I wanted to give everyone a quick little primer here so they know what information we need to get started on the metabolic protocol. We generally just need some recent information from your standard of care. These are things that are easy to pull up and submit to us so that we can offer the protocol in a safe and predictable way. First of all, we want your original path report to show and verify you have cancer and where it's from and some of the specifics of it. We would also like any major reports on like the surgeries you had, chemotherapy courses, radiation courses, immunotherapy courses, and then maybe any recent clinic notes from the last 3 months or so, recent scan reports that are relevant to your cancer. If it's not really relevant to your cancer, we probably don't need it. Tumor markers that are relevant to your cancer. As you know, some cancers have very good tumor markers that can be followed. I've listed them at the bottom here, the main ones. Some don't. So don't be surprised if you don't have a specific tumor marker. We do need some labs before we get started. Some of our medicines can impact some of the functioning of our either bone marrow, kidneys, or liver. So we want to make sure those are stable and functioning normal before we get started. We like to see a complete blood count just to check the white blood count, the hemoglobin, and hematocrit. One of our meds has a very rare, almost idiosyncratic, remarkably rare impact on the bone marrow. So we want to make sure that's stable before we get started. We want to check the basic metabolic panel. This is just a group of electrolytes and also measures of the elimination of certain proteins that reflect kidney function. You may have heard of the BUN and creatine. We want to get those levels and make sure that they're normal before we get started. We also want to check something called the Chem20. Chem20 is approximately 20 measures of common serum markers, and we want to check the liver function, the AST and ALT. Those are the two main labs that reflect liver function. Because one of our medicines, rarely so, can have about a 1 in 33 possibility of impacting liver function tests. And so we want to make sure we know where they are before we start these medications on you. We also check the labs at about 5 weeks after you've been on the metabolic protocol for a month. And then we recheck it again every 90 days. And once again, most patients are getting these through their standard of care oncologist and general physicians. So these are not too unusual for oversight and management of a cancer patient. We also frequently check the vitamin D level. So if that's available, please submit it. We believe in optimization of that. And then again, once again, there's plenty of tumor markers. If it reflects your cancer, we would like the most recent ones to see what your baseline is before we start. Well, I'm Dr. Meakin. It's an honor to be at your service and helping you. Please check out the rest of our website for more information. Thank you.